Hello, everybody. First off, thank you so much for joining us here today. We're going to talk about driving patient loyalty in healthcare systems. Just for a little bit of context and an introduction, you have a mixture of people on the phone here today. So we have some loyalty experts from Lacek Group. We also have Terry Casterton from the Bottle Rocket Group talking about connected patient experiences, and Rajesh, who leads Ogilvy Experience. So throughout the call today, you're going to hear a variety of company names. We all are a part of Ogilvy Experience, which is a holistic end-to-end customer provider where we can help you enable digital solutions for your customers, ensure the customers are able to reach those solutions, engage those customers over time, all in the hopes of retaining those patients and ultimately driving patient loyalty. So today we're going to talk a little bit about what is patient loyalty, why is now the right time to invest in patient loyalty, how that might come to life within each system based on your individual brand, and some actionable steps to get started. So kicking things off, I just want to introduce myself, let all the panelists do the same. I'm Peter Klayman. I am the VP of Business Strategy at Bottle Rocket. Really excited to be moderating this discussion today. Terry, you want to go next?
Yeah, you bet. Thanks, Peter. And hi to everyone out in our audience today. Thanks for joining us. Terry Casterton. I'm the director of our healthcare product and strategy group at Bottle Rocket. I got my start working in health IT, working on the EHR implementation side of the world 20 years ago, which is a hard number to swallow sometimes. But I've been drinking the healthcare Kool-Aid ever since. I worked for a healthcare system for the last several years, leading our innovation and virtual health group, where I got to do really exciting things at the intersection of strategy, operations and outcomes, and technology, like launching a direct-to-consumer virtual health approach, and also building a mobile app that blended many disparate systems together into a cohesive consumer experience for the population that we served. And excited to be here at Bottle Rocket and working with our clients to do similar types of initiatives.
Awesome. Tess?
Good afternoon. Happy to be here with you all. My name is Tess McGibbon. I lead the thought leadership and healthcare efforts at the Lacek Group. A little bit about my background. I've been in healthcare for 25 years. I share the same gulp with Terry. I started out in the dot-com boom, building the world's largest physician online audience at Medscape, and also, working on the advocacy side with the Medical Alley Association, and in between there, served in leadership roles at 3M Healthcare, Abbott Laboratories, and Coloplast. I'm excited to have this discussion.
Awesome. Julie?
Hello, everyone. I'm Julie Bustos, and I have worked at the Lacek Group in loyalty marketing, primarily in consumer industries for 25 years, always on the technology and data side, and really look to leverage data to understand how to create the value exchange between the business and the consumer in a way that makes sense for both, and use signals, use data to understand unmet needs, maybe even unknown needs, and use marketing communications to meet those needs, look for opportunities for innovation, and streamline the relationships that we have with consumers across the board. I've also taken on a role within the Ogilvy Experience business at large as the global lead of data and analytics. So really excited to talk about data and how we can use data to drive growth and consumer happiness.
Great. Rajesh?
Hi, I'm Rajesh Midha, and I am with Ogilvy Experience. I'm super excited about today's session. Thank you all for being here. Prior to being at Ogilvy, I was the chief product officer at a company called Quartet. And Quartet was focused on taking payer data as well as data from EHRs and writing predictive models around seeing if we could predict when somebody would have a future case of a behavioral health issue. And moreover, thinking about how do we actually help get that person to care. We created a physician experience within the EHR where we would start servicing patients that were coming in for an appointment, so the physician could talk about their mental health care journey, and then we realized that these visits are so short and they're compressed for time. So we thought about, okay, then we built a patient experience where there was this chat function. Been in and around the world of thinking about healthcare innovation, but also how to make healthcare innovation scalable and adoptable within different health systems or healthcare environments. I'm really excited, looking forward on everything going on around the patient experience. I think there is an incredible opportunity to bring the best of the business to consumer world into healthcare. And and so I'm looking forward to today's session. Thank you.
Excellent. So for those of you just joining us, we're going to be talking about patient loyalty today. And maybe we just start at the very beginning. Why is it so important to keep patients loyal within the system today? Tess, you want to kick us off there?
Sure. Well, the healthcare consumer has been evolving over time, as we do in the other consumer world, right? But it had been accelerating in a post-Affordable Care Act landscape as more dollars were coming out of pocket and people were becoming more active in their personal care. And COVID recently has just accelerated all the trends that were already in place. And recently, Accenture did a healthcare consumer study in COVID-19, which produced the analysis that health systems that evolve to meet new customer experience needs can expedite financial recovery and capture patients from competitors. And as a follow-on, NRC Health just reported that most healthcare consumers don't have a brand affinity to health systems. And that went from 31% in 2018 to 36% in 2021. So what is patient loyalty? Loyalty is about feeling connected to your care providers, feeling that you are having a streamlined experience throughout your journey. And people are reading reviews and they're now leaving reviews. And so to engender that patient loyalty is to really bring them through the journey in a personalized manner. And that is how they're being treated everywhere else within their brand experiences. So it's really important for health systems to take a look at that now because they have set the imperative, they're expecting it.
Yeah, one thing I'll just tag on to Tessa's comment there is, because she mentioned a journey, which really is part of that loyalty and retention and the component of a digital journey. And Tessa's kicking things off with such great numbers. I'll tag one on there as well, which is a number coming out of a Forrester study last year, which is 28% of healthcare consumers switched their provider because they had a poor digital experience, a poor journey with them. So now more than ever, people are making decisions based on their experience, which is influencing loyalty, and it will impact the bottom line for healthcare systems if not given the appropriate focus.
Love that. And, it's really nice to link this because we're not just talking about patient experience, we're talking about profitability and systems growth, right? So we're talking about how do you leverage some of the tools you already have at hand to help make a better patient experience. So Julie, when we're thinking about that, what types of data sources are we typically talking about when we're thinking about patient experience and using that to create a form of loyalty?
Yeah, well, as everyone on the call knows, I think healthcare systems have a lot of data about their patients, no doubt. And I think that a big opportunity is to understand what we know about that patient, what we know about their health, what we know about the context that they're living in, and use that information to deliver relevant communications, relevant advice, relevant experiences across their end-to-end healthcare journey that will help them achieve better outcomes, that will help create a relationship with the healthcare system that they're engaging with so that they don't leave the system, like Terry was saying, so that they don't, so that they build affinity, as Tess was saying, and continue to consolidate their business with a particular healthcare system. I think on the system side, there's, in consumer marketing, there's always customer lifetime value metrics. There's a way to understand what the value of a customer, in this case, the value of a patient, is to the system and how to optimize that. And I think similarly, we would look at data sources that would help us triangulate not just the transactional value or cost, in this case, of a patient, but also metrics that would help us understand how a healthcare consumer thinks, how they make decisions, what sorts of things they care about in their life. In other words, we can now start to understand consumers, patients as people rather than one-dimensionally. And we want to bring that into the forefront and use that information to really understand the multidimensional person and the whole relationship, the whole value that they can provide for the healthcare system from a business perspective. And it's really aligning those customer value metrics, those patient value metrics, and the value that we're providing to customers in a way that makes sense for the business and a way that makes sense for that consumer. That's going to lead to a mutually valuable, mutually happy, again, type of relationship.
So before we unpack how to get to patient lifetime value, customer lifetime value, because I'm sure for many of you on the call right now, you're like, that's a daunting task. And it definitely is. And we can talk a little bit more about that. So we kind of have established this need, right? Whether it's being population health is one of your core metrics around how you're going to be compensated as a system, greater choice from a consumer perspective, and consumerization of healthcare. Let's just level set, right? Because, when I first heard about healthcare loyalty, I was thinking, oh, hey, gallbladder got removed, you have 3 free doctor's visits. How great. Or, maybe it's like buy 4, get 1 free. That's not what we're talking about, right? So Tess, what are we talking about here? Like, what is healthcare and loyalty at the highest level?
Highest level, when people think about loyalty, they often think about points or miles, a very transactional exchange between a brand and a consumer. Loyalty in healthcare should be really approached as a strategy that includes personalization, leveraging that data, multiple touch points that make your healthcare consumer feel known, feel recognized, and feel valued. That's how you create customer loyalty within a health system. It's not about exchange of points. For instance, let's say one of your patients is coming in for their first chemo appointment. Perhaps you have a book of an anthology of poetry written by oncologists, survivors, caretakers. It's recognizing the humanity within healthcare. These types of different touch points, perhaps it's sending a personalized prevention checklist at the beginning of every year for that particular family. It's individualizing, it's personalizing, and it's valuing the relationship. That's where loyalty is engendered within healthcare.
It makes a ton of sense. So now that we kind of want to embark on this journey, right? There's some precursor steps before we start rolling something out. And Tess, you mentioned a great oncology example, but is oncology the first patient population that you target? How do you make those types of decisions? Rajesh, what advice do you have for healthcare systems as they start to think about loyalty at the very earliest stage?
Yeah. Okay, great. So discussion has been so fascinating. I think, we often start at Ogilvy thinking about what it is that we're trying to achieve and where are we today. So like this real clear assessment of like, where are we trying to go? What is our strategy and what is our starting point? And so thinking that through, and once we have that, we start to think about what are the leading indicators of success. Not the indicators of past success like revenue or like profit or like costs around serving. It really thinking about like what is it that's going to help us to achieve our objective that we can look at to know that we're on the right path, and we call that North Star metrics. And every health system that I've worked with typically has really good dashboarding, some terrific strategy, but we also use that framework of here's where we're trying to go. Here's how we're going to measure ourselves, to sort of say to ourselves, okay, we can't do everything. So let's do a few things really, really well. And typically we find that breaks down across a couple of different spectrums. And of course, it depends on the region and the type of population you serve, and whether it's a Medicare population or a Medicaid population. These kind of things really impact that. But that's how we go about really thinking about it in the early days.
Makes a ton of sense. And so we're really talking about no one size fits all approach. We're talking about holistically building those relationships based on where your competitive advantages are, where your patient needs are. Terry, how do we get there, right? What part of the customer journey do we start assessing to understand where is the place to start playing, assuming we want to go after patient loyalty, we've established some North Stars, we understand what the overall goals of the program are. How do we set expectations with leadership? How do we start that journey? And how do we actually get going to find those first set of experiments?
Yeah, great question. And in order to answer that question, I'm going to take this in a slightly digital route that also addresses the individual needs of a healthcare system's strategy as well. And there are some key components when we look at digital levers to pull that can help as the starting point. The starting point, though, should feed a seamless digital consumer experience to keep them engaged. One of those things, let's just look at the obvious, the electronic health records that most healthcare systems have invested in so heavily. We don't want to throw the baby out with the bathwater, if you will. Those EHRs have rich information around appointment booking, paying bills, also other elements of the revenue cycle, messaging care teams, refilling medications. We got to preserve that. It's a key component of how you engage and how you build loyalty. Other digital touch points to start considering and or to pull forward if they're already in place. One, transparency around pricing, and also transparency around provider reviews and ratings to inform patients about the decisions they're making about where they're spending their healthcare dollars. Also looking at the access points for patients. That's another really important component to loyalty. Over the course of 2020, many healthcare systems built out their access points to levels they never thought were possible, thank you to the pandemic and the boom of telemedicine. So what was once predominantly in-office visits or in-hospital or in outpatient department visits, now we have synchronous and asynchronous virtual services to add to our access point strategy within healthcare systems that are important components of loyalty as well. And then last but not least, in terms of components, and this touches on something that's been, I think, brought up by Tess and Julie and Rajesh, is knowing the person. And part of knowing the person is knowing where they are in their care journey and going really deep on specialty services. Specialty services like maternity. Where is a mom at on her maternity journey? And that may require a special set of tools. Same for diabetic patients and heart failure patients, or remote monitoring devices for hospice patients at the end of their life. This is a great time to understand a healthcare system strategy, where they want to focus on, to build off of what Rajesh was saying, and figuring out which digital levers to pull to support those strategies. Now, the most important component in all of this, because that's a lot of different touch points, right? And if you are the cancer patient presenting for your first chemo appointment, it is daunting to have to keep track of 10 different logons for the appointment, for your medication refills, et cetera. So the last point is the enablement layer. How do we pull all of these disparate systems together into one system that is convenient and it removes the friction? And this is where I think a lot of healthcare systems are focusing, whether that is a bespoke solution or something off the shelf, how to pull those things together to remove the effort from your patients and make it easy for them to navigate what is some of the most complex experiences that they may ever have to navigate in their lifetime, and pulling it all together in a way that is brand forward. So as you leave the OB clinic and go to the primary clinic and then also have a hospital admission, you're aware as a patient where you're going, and a hospital can be brand forward and make really clear what the umbrella of services is that they're offering. So that's just some highlights of components and that enablement layer that is so important to help build loyalty from a digital perspective with the patient population.
Well, and add on to that digital piece of things, one of the greatest benefits of a patient loyalty strategy is that you are centralizing the care right within the system. So you aren't on one EMR, EHR platform at your oncologist and on another one within another system with your primary care provider, and your children's is yet within another system because that's the clinic that's the closest, right? With a loyalty strategy, one of the best outcomes is that by keeping your families or individual consumers within your system of care and managing that for them through digital strategies, through different access points, providing the convenience, which we know is the number 2 most important driver in people's healthcare decisions, you're keeping their care uninterrupted. And thereby you have the opportunity to add in those layers of preventative advice. You're able to curate content, delivering through these different, this centralized platform, all of the information that they need, the care that they need to feel, the value that they're being given, and that you're grateful that they're giving you as well.
So makes a lot of sense. Need to be able to communicate with your patients in order to drive loyalty, and you can't trust each of your individual providers to give that holistic message because they have different goals and they're optimizing against different outcomes. So you're trying to take your entire brand and create a unified communication center, whether that's through an application experience, a comprehensive web experience, some type of front door that they can enter your system through. So we're not talking small dollar amounts here, right? We're talking about very large purchases that are pretty urgent, that have elements of complexity associated with that purchase lifecycle. Julie, when we look at other industries, how have we seen other industries with large ticket items, infrequent purchase cycles, navigate loyalty, and what lessons can we learn from there?
Yeah, great question. I think some of the lessons really quickly are to test and learn, and test and learn and scale. And I'll use an example from the cruise industry. It's an infrequent purchase. It's not something that's always top of mind. And in the cruise industry, what we have done to help build the relationship is really be a proactive organization in terms of communicating and understanding, more importantly, when the right time is to communicate. And that's something that we can understand from building models on how often typical people cruise, apply that to the database and use I would call that a latent signal to trigger a message that's going to be relevant from a timing perspective. If the average consumer just cruised, for example, 2 months ago, they're not likely to cruise again for another 20 months. And so pushing sales, pushing irrelevant information doesn't make a lot of sense there. So really being smart about what are some of the signals that we can understand that allow us to be proactive in our communication, I think is something that applies from other consumer-driven industries into the healthcare space. And I think health systems, again, have access to a lot of different types of data. And I think oftentimes consumer engagement with healthcare systems has been triggered by a patient reaching out because they have a healthcare issue that needs to be taken care of. Instead, I think there's a huge opportunity to look at the type of data that healthcare systems have, look for opportunities to be proactive with communications when there isn't an imminent healthcare issue happening, and look for patterns in that data that would suggest that a communication about X, Y, and Z topic is proactive given what we know about a patient's context, a patient's visit history, a patient's condition, and reach out proactively with messages that create that dialogue, create that sense of caring, create that sense of value exchange that can lead to a long-term relationship that can reduce the reason for defection to another healthcare system or seeing a provider out of network. And I think that those are things that we can learn from other industries for sure. Look for those signals, be proactive in the communications. And as Tess, Terry, and Rajesh were also saying, I think another thing that we can learn and take into the healthcare industry is how do we make navigating that whole healthcare journey as easy as possible. I know as a healthcare consumer that doesn't have a lot of professional expertise specifically in healthcare, that it's often confusing to figure out what I need to do or my loved one needs to do to really manage their care effectively. And if a healthcare provider were to provide me that information in an easy to consume way, I wouldn't go anywhere else because they're answering a question that I have that's highly emotional for me and providing me a solution that makes sense and makes my life easier. And I think more than many other industries, healthcare has an opportunity to make a real impact in people's lives, make that emotional connection, and help people get real better outcomes with their healthcare for themselves and the people around them that they have responsibility for.
I love that too. And I'm sure many of the healthcare providers out there will also like that because a lot of that content's likely already written, right? We're not creating new content all the time. We're just surfacing the content to the patient populations that it's most relevant to in a moment that it's relevant to them. So Rajesh, I know that you've had some unique care experiences because you've got to experience newer organizations that are new to the scene, providing new types of care. Same question as I asked Julie, but a little bit different, which is where are you kind of seeing some innovation specifically in the healthcare space of new models and things that can help drive some different ways to consider how to deliver care to patient populations?
Yeah, I think one of the really interesting facets is when we think about taking care of a patient over a lifetime, from stages as a young adult. I have two kids, 9 and 11. As a young preteen, my daughter always says she's a preteen, all the way through, my dad's going to turn 80. He's like that care journey and the things that they need at each stage is different. And the way that they want to access that care is different. But what has become clearer to me is that the central theme that consistently runs through it is that the most personal device is the way of maintaining that relationship. And how do we, the device, I won't tell you how many hours Apple told me I spent with my device, but that how do we take this means to be able to because sometimes I need to have a telehealth appointment because my daughter has a rash and I want to understand what's going on. And other times I'm like, she needs an inoculation. We got to go see the doctor, right? There's different times and different ways that I want to interact and be a part of accessing healthcare with our health system. So how do we deliver that? How do we make sure that we're serving the different segments and the way that they want to access healthcare at any given time? And I think that to me is where all of this innovation can come. But the fundamental start, of course, to any innovation is making sure that there's some baseline level of experience, right? Unfortunately, I think what's happened in healthcare is that the EHR providers have come out with products like MyChart and said, here you go, we've done it all for you. But what's hard is that there's just no customization that is available around a MyChart, right? Great, you've got MyChart, but how are your patients going to access the pharmacy and telehealth and these other things that you need to provide in order to really take care of a patient at all stages of their life?
So we've kind of covered the gambit, right? We've talked about how the continuum of care influences patient expectations, how patients want to be communicated with in different ways. We've started to introduce experimentation. We understand the mandates and some of the market pressures that are driving the need to retain patients. Sounds great. For those who are listening right now, what are some ways to get started? How do you actually start to peel back this onion, start an experimentation program? And even before we say that, I just want to say, I think historically healthcare has gotten a bad rep to not be open to experimentation, but this last year in particular has proved that to be factually incorrect, right? Healthcare systems are very open to experimentation. We just have to set the constraints of what that program looks like and set some clear expectations amongst the leadership team of what it's going to enable. So Tess, you want to kick us off? How do we start on this journey?
Sure. I think before taking any steps, you have to look at your data, understand your customers, your patients, your healthcare consumers, your whole population. You have to understand who they are and then identify where the gaps are, right? I mean, before you walk, you have to crawl. And so getting that understanding and then what systems are in place to enable that test and learn environment that Julie was talking about. So I always suggest, Rome was not built in a day, right? Let's build the house and we can then add the pool and the fence and whatever else, the new driveway. Let's build a foundation, test, pilot, make sure that the initiatives that you're putting in place are resonating. That's how you get started. Where are the places that you can begin to optimize and then think bigger and grow out? But you can't do that until you have a really clear understanding. You do an assessment of your data, your systems, your customers.
I think one thing that we like to do is work with the client to understand where their biggest cost drivers are, where their biggest business opportunities are that maybe they're not able to achieve, and focus on where we can tackle those, because the impact that we can make there is likely larger. Also, what comes into play quite a lot is what is the feasibility of making it happen. And I know in one case with the healthcare system, we were talking about creating some personalization around a particular offering that they had, and they weren't operationally ready to deliver on the additional demand that personalization would drive to their business. So we have to balance where there's a business opportunity that also is something that's feasible and that the system is ready to be able to deliver against. So there is definitely a pragmatism in there, and that's all part of an onboarding or a discovery process, so that we can identify where we can make an impact, test that, learn from that, revise that, and then scale that into other areas of the business based on the impact that can be made.
Yeah, this is a hot question, Peter. Everybody wants a chance at answering it. Another way to frame where to start, and this is taking us a couple of steps back here, but looking at what is happening on the economic front of healthcare and how payment models are shifting from fee-for-service to more outcomes and value-based in nature. And I think that is a fantastic place for healthcare systems to start their loyalty journey and solving for a specific population that already has economic incentives to figure out how to keep them loyal, i.e. how to keep them healthy, because it impacts the bottom line. And with that, some of those areas, orthopedic surgeries, right? There's a very specific pre, intra, and post care journey that a patient can and should follow in order to be successful with their outcomes, whether that be a joint replacement or something else. And I think that is one specific area, and similar for chemo treatments, similar for cardiac care. Those high utilizers who need care, perfect place to start. And to piggyback on what Julie and Tess have mentioned, understand them as consumers, not just a patient with a medical record number, but how do they want to consume services from us? Do they prefer online booking? Will they pay their bill online? And if not, maybe we need a middleman, a person, an individual. I spoke earlier a lot about digital tools, but I don't want to undervalue the people tools that can help in this as well, and how understanding what the preferences of a specific population, given their age and other demographics, language, other social determinants at play into how they want to interact with their healthcare system. And I think those populations in more risk-based contracts are an ideal place to start and to understand that population and cater a tool set of people and digital technologies in order to serve them best.
Awesome. And I do see we have a couple of questions floating in. We will make sure to answer all these towards the end of the call. And we'll make sure we keep some time for all of that. Obviously, say you want to go to the senior leadership team of a healthcare system, say, hey, we want to try a new experimentation program focused on some of our highest risk patient populations to drive greater continuum of care through a unified loyalty program. The next question I would ask would be, okay, cool, where's that happening? Right? So as these systems start to look for comps in the marketplace, are there comps and what can we learn from them? Tess, you want to take us away on this one?
You know, loyalty in healthcare is still largely conceptual. We do have, particularly within the payer system, some examples. Kaiser Permanente, while one of the largest IDNs in the country, is also a payer, and so they have a unique closed system. But they, for 9 years running, number one patient loyalty and in Net Promoter Scores, and 4 years running within the Forrester insurers evaluation. They start with prevention. So we're flipping that model, in the high risk, but they start with prevention. Complete these healthy behaviors, these 5 or 6 healthy behaviors in this calendar year. And at the end of that, we are rewarding you either with a $500 gift card or a $500 statement balance. And that's up to 2 adults in the household per year. But they will be the first to say, and have said, the loyalty starts from within their organization. It is a full buy-in. They have been ahead on progressive measures like farmers markets for their community to come to, on their campus. They're a very successful example of in-market. It is not a health system. A couple of health systems have put together premium packages of subscriber services. Those are in market. I believe Cleveland Clinic is one of those. At a time when the inequities of healthcare have been a part of the discussion for the last couple of years, if that might be a risky perception to take on, but it might fit your business strategy as well. But those are a few that are in market to look at, to look to. We're seeing more and more strategic partnerships in health system and med tech partnerships. So they're emerging, but there's not a lot of places to turn yet for prime examples.
Hey, you heard it here first. Could be a competitive advantage for your healthcare system if you take a leader-based approach. Now, with experimentation, you can also do risk mitigation as well, right? So consider that. You don't have to dive fully into the pool in order to get started on this. So I want to make sure we keep quite a bit of time for questions. And if anybody has questions, feel free to populate them in the Q&A section right now. But before we do that, I'd love to hear from each of you. How would you succinctly define a loyalty program for a healthcare system? Terry, you want to kick us off?
Yeah, succinct. Not always my strong suit, but I like the challenge. Know me, connect with me how I want to be connected with, and anticipate my needs. Those are the components of a loyalty program.
Ooh, easier said than done, but man, setting a high standard. Cool. Julie?
Yeah, I mean, for me, I think of a loyalty program in healthcare really as the application of a loyalty strategy. And it's behind the scenes for me as a consumer, but it's the healthcare system showing that they understand me and my needs and my family's needs, and proactively making it easy by giving me the information that I need to have healthy outcomes. It's that outreach, that anticipation, and the delivery of that satisfying experience that I expect in other industries and haven't really gotten from the healthcare industry yet. It's possible, but give me the same type of experiences that I get from other industries.
And the forces of consumerization are reaching across the entire spectrum, huh?
They are.
Wow. Rajesh?
Yeah, it's a great answers. A great question. I think about it like, there's a reason why your patients come to you, health system or walk-in urgent care clinic or whatever specialty cardiac provider. There's a reason why that happens. And that reason is your brand, right? That's your personality. That is the trust that you built. So when I think about like patient loyalty, I think about like, if brand and experience are two sides of the same coin, how do we bring that promise that you make to care for whatever group you care for? How do we bring that into the experience? And so I think personality, brand, right? And then I think there's something about engagement, right? Making it like and that's the experience side of it, like making it so that it's now the brand promise can be realized. And then I think the third pillar for me would be joy, which is like at the end of the day, when we think of healthcare and our healthcare experience, rarely do we talk to people and you're like, oh, how did you feel after that? And you're like, joy. Like you don't hear that so much. You're like, oh my gosh, I waited for so long. And like, it was like this thing and I had the form and then like it didn't work. And like, you're like, but how do we do that? Right. I think that in itself, bringing that joy, that engenders the loyalty. And moreover, when we think of beyond one step beyond loyalty, we think of the word advocacy. How do we turn the people we serve into the biggest advocates for our brand?
Awesome. I did have a joyous experience. I applied for telehealth and within 5 minutes, a doctor called me, not like a nurse practitioner or anything, a real doctor called. I was floored. That was incredible. I couldn't believe that was possible. Yeah, that was awesome. How cool is that? So watch out, healthcare systems, because millennials are going to start spending a significant amount of money with you. And we're going to bring our expectations around how we expect to interact with any digital forward business into your health system as well. Okay, Tess?
It's a really precarious position to be put last, especially after 3 really great responses. Data shows that more than 70% of people will exchange their most personal information, which is their healthcare information, for a streamlined digital experience. That is a component of that, bringing all the pieces together, having an unfractured, centralized care experience. And, here's the deal. IDNs are uniquely positioned, unlike maybe any other business sector, to care for a person in their prenatal state to holding their hand in hospice. Keeping patients loyal is everything everybody said here, right? Giving them no reason to leave. Recognize them, understand their needs, provide the digital tools they know they need, the access points, and perhaps let's go outside the digital experience. Maybe they need home health care, right? Maybe they want their vaccination to come to their house because they don't have the mobility, right? Maybe their bandwidth isn't that great and telehealth isn't an option either. It's meeting your customers and your patients and their caregivers where they are. And then finally, it does all begin at the understanding of your consumers. When we talk about loyalty, it's typically in the framework of retention, keeping people within your business strategy, right? Keeping them cared for through the continuum, whether you're buying a blouse in a retail store or you're having a baby, right? We want to bring them through that journey as smoothly as possible. But one of the great benefits of loyalty and understanding your customer and your data is you can start to overlay other data, right? Third-party data, public health data to anticipate, right? We can now start creating it's the population health model. Where can we now look at even the broader pie, the whole pie, and say, okay, we know that this particular geography has a higher incidence of diabetes. Where can we get out and meet and pull more people in? You create lookalike audiences and you can acquire people into your system. It's so wide ranging, and the possibilities and opportunities are so fruitful or can be fruitful, that if you take my answer and combine it with everybody else's, that's what patient loyalty looks like.
That was great. Okay, so 2 questions here already. I want to make sure everybody gets a chance to ask some questions, but this one just so perfectly aligns, Tess, with what you just touched upon, and that is, how do we use this loyalty model to try to reach specific population health groups? For example, Black birthing people, uninsured, those that don't trust the system. Terry, you want to kick us off there?
Yes, I do. I think this goes back to something I mentioned earlier about recognizing who your population is and how they want to be connected to, because it won't be the same from demographic to demographic. And I think one trend that's been really significant, even internationally in underserved countries, that could really stand to be blended into a loyalty program is the leverage of individuals within the communities that are traditionally hard to reach. The appropriate label for it is a community health worker, but I think understanding and employing somebody as part of a healthcare system to be a brand ambassador to promote what those services are and to have conversations at the community level with targeted outreach to those who particularly need care, which might be a Black mom ready to deliver her first child into the world, or someone who's uninsured but very, very unwell. Oftentimes, a great entry point is a conversation with someone who is trusted. So really, I'm a huge advocate for the community health worker model in those populations. I think it's the perfect jumping off point to engage them in more digital medium. But first, you got to build that trust, and that's a challenge in some of the underserved markets. Once you build that trust, though, many individuals are connected, more so than you might think, and pulling them in at the appropriate time and place after that conversation to a journey that enables the right care, the right conversation at the right time. So it's not looked at too much in an over expense, because that is important to certain populations. A fantastic opportunity to take advantage of, and a great place to experiment as well, building off of the earlier part of the conversation.
And I'll just jump in on that same question, if it's okay.
Go for it.
And I'll read it again just so everyone knows. It's, how do you use this loyalty model to try to reach specific pop health groups? Love that we're talking about pop health, Black birthing, et cetera, uninsured, those that don't trust the system. And I think that one of the things that we've seen work really well in other industries that we're trying to apply here to healthcare is this idea of like human-centered design. And so there's a human-centered design process. Often it's referred to as design thinking. And, it's taught now in schools, thinking of Stanford and the design thinking group over there, that was formed in and around, Steve Jobs used it probably to the most avail when building the Apple mouse, and worked with a company to help him do that. It's this idea of like really going out and hearing what the problem is. And then once you hear what the problem is, thinking about like a whole bunch of ideas to solve that problem for that one community. Like, what's the problem with Black birthing and why they're not engaging in the way that we want or think they should for better healthcare? And it's like, you kind of got to go out and like talk to people and understand the issue. But how do you do that really fast and come back and ideate and quickly prototype and test a potential solve for that issue that you heard? And that's what we call this design thinking process. And so we run, sprints. So like in a day to 3 days, we will come in and we will work on a specific population to try to get some sort of breakthrough in terms of how to get them engaged. And first we build that engagement model in something we call low fidelity, right? Meaning it's not digital, there is no app, there is no potential clinic. Sometimes we even act it out and we bring real people in and we're like acting like the doctor and engaging with them in a certain way, or maybe we're going to the community and educating in a certain way. And we experiment. And then once we have resonance and we're showing that it is making a difference, then we think about scaling that idea. And the benefits of doing it this way is, one, you're learning from the real population. Two, you're experimenting in a way where you're not spending a lot of cost or wasting a lot of time. And three, you're making sure that you're only taking the best ideas forward.
Man, we could just spend all day on that one question. Let's go to the next one, though, because this is also going to be a zinger. How do you have some high level thoughts on effective or important digital touch points and or the metrics across the continuum of the relationship life cycle? What about different strategies for different stages like reach, acquisition, development and nurturing, retention, and advocacy? Big question here. So let's try to keep it under 5 minutes, but I know a bunch of people are going to want to answer this one. Terry, you're on the cusp. Go for it.
I was actually going to see if Julie was going to
I was too, actually.
On the data side of it, but I'll take an initial stab at it here. So I'm going to start the last part of that question. Are there different strategies for different stages? Yes, right. I'm put on my product hat for a little bit, and where a healthcare system is headed and what their strategic objectives are and what their North Star is should guide how you measure these. So let's say you're taking a telehealth service and you're scaling it, and that is going to have a different set of measures and or touch points for these. So I think it's important to boil it down to what is the product and or service at hand, and what are we trying to do from a business perspective and align the tactics to it. But let's go deep for a second, just on we're going direct to consumer with virtual access points to meet the Peters of the world where they are with their care consumption needs. One way to look at reach is how far out of your normal, if you will, geographic boundaries can you go, because you no longer have geographic constraints in place with the population. And then that could also feed acquisition. Where are you growing in new markets that you otherwise weren't able to serve because you've taken the geographic boundaries out of the way? And retention, a big one on the telehealth front right now that touches on like how you might get patients to be loyal because you're giving them a new access point is if Peter's first visit with your healthcare system is via a video visit, is Peter coming back for more care? Is he coming back for in-person care? Do we have him on that journey to make it simple for Peter to get not just his video visit for the rash on his arm seen, but also to bring him in next year for a physical and make sure he's using your services for lab draws and prescription fills, et cetera. So it is a challenging question to ask. It is a simpler question to ask when you boil it down to what is the thing that we're trying to work on and develop and work with the metrics there. And then I'll also encourage folks to develop a portfolio approach, which for a lot of folks is your scorecard, which just about every healthcare system has. What's already on your scorecard and leveraging those to be your measures, if you will, with specific metrics broken down that focus on patient loyalty with some of the examples that I just provided on the virtual health front. Julie, what do you have to add to that one as our data expert, analytics expert on the line?
Well, my answer would go way deeper. I thought your answer, Terry, was perfect and really informed by the healthcare industry. And I think it is really important to think about what problems are we trying to solve for the business, for the consumer. And we would go in just really from a practical perspective and establish a measurement framework that allows us to measure our progress against those objectives. And those are different based on the different stages that are laid out in the question: reach, acquire, develop, nurture, retain, advocacy, for sure. And I think the other thing, Terry, that you pointed to was we can learn from different cohorts how to optimize each of those different engagement strategies across each of those different stages as well. So in the example where Peter engages first through a telehealth engagement, and he may attrite after that and never come back, what can we learn about others who had their first engagement via that channel, who did come back and engage with us either through the same channel or different channels, and what can we learn from that would allow us to put strategies in place that would keep people like Peter in the system, because we've learned a different way to engage with him, or a different cadence in our communication, or a different type of message to send somebody who's had similar behaviors. So there's a lot there for sure. And I get really excited about all the ways that we can use data to improve engagement across all of those different stages. But I think we went over Peter's 5 minutes, so maybe we'll have another session to dig deep on that.
It's okay, Julie. You know how to get me excited. Talking about adjacent user theory is always the most exciting thing to talk about. Okay, but I do want to make sure we get to this last question because it's a great one. What, in your experience, is the difference between personalized versus personal? Great question. Rajesh, you want to kick us off there? Personalized versus personal.
I'm definitely not the best person to answer this question. I mean, I think, I think I use them interchangeably, and I think I would learn a lot hearing from somebody else. So I don't know, does anyone have a point of view on it?
I got a thought. Oh, sorry.
I was just going to say, I think healthcare is actually a very unique industry within which to answer this question. Personalized, your communications are personalized, the content is relevant, right? The organization has taken that opportunity to personalize its interactions with you. Personal healthcare is personal, right? There isn't a lot out there that's more personal. It's your self-care, it's care for your family. So when, for instance, I would consider this personal, you know that this family is coming in every week for their child to get an infusion, right? A personal experience within the health system might be, here, we know this is hard. We know you're coming in all the time. Let me give you preferred parking. Let me give you some premium parking. Or, every once in a while, let us buy you lunch while you're waiting. That's a personal experience within a very personal experience, right? Personalization, relevant content, personalized messaging, hitting those channels within the digital space in an automated way. That's a great idea of personalization versus personal, in my view.
Okay, so we are at time. First off, thank you everybody who was able to join today. Really appreciate you being here. If you want to take any more of these strategies and start through that cycle of implementation, feel free to reach out to anybody on the line. We will be sending a deck that follows up with some of the contents we discussed today, as well as some easy ways to get started. We hope this was very helpful as you start to evaluate how you can gain a competitive advantage through patient loyalty, and definitely something to prioritize on this year or next year's roadmap as you start thinking about ways to retain those patients and ensure that you're staying competitive in some of your highly competitive regional areas where you do provide care. Thank you so much.
Thank you.
Thank you.
Thank you.
Thanks, everybody.